Okay, stop scrolling. I need you to hear this. Because what I'm about to share with you today is something most men never get told. Not by their regular doctor, not by their urologist, and definitely not by anyone who actually cares about what's happening below the belt. You've probably heard that olive oil is great for your heart, great for circulation, great for your overall health. And that's true, partially true. Because here's what nobody tells you. Olive oil alone is one of the most incomplete strategies a man can use when he's trying to support blood flow, vascular health, and sexual performance. I'm not here to scare you. I'm here to educate you. Because in my years of working with men and with couples, the number one thing I see destroy confidence, intimacy, and relationships is poor circulation. And the solution is simpler, more natural, and more powerful than anything you'll find in a pill bottle. Today we are talking about one of the most underrated, scientifically backed, kitchen shelf remedies known to men's vascular and sexual health. And that is apple cider vinegar. Used strategically, used correctly, and combined with the right ingredients for maximum blood flow. Stay with me, because by the end of this video, you are going to understand your own body better than most men twice your age. For those of you who are new here, welcome. I am Dr. Lila Romano. I'm a sexual health physician and intimacy counselor with over 15 years of clinical experience working with men, women, and couples navigating issues of circulation, hormonal health, sexual wellness, and relationship intimacy. I work with men of all ages, from their 20s to their 70s, and I can tell you this without any hesitation. Blood flow is the foundation of male sexual health. Full stop. Every single issue, whether it's erectile dysfunction, low stamina, reduced sensitivity, or poor performance, almost always has a vascular component. It starts in the blood vessels. And when men come to me asking what they can do naturally, without immediately jumping to prescription medications, I always start with the same conversation. I ask them two questions. What are you eating? And what do you know about your endothelial health? 9 times out of 10, they have no idea what the endothelium is. And that's the problem. Because once you understand this, everything changes. So today, that's exactly where we're going to start. We're going to talk about the science, we're going to talk about the remedy, we're going to talk about how to use it, and I'm going to give you a practical protocol you can start today. Let's go. All right, let's talk science, but I promise I'm going to make this easy. Inside every single blood vessel in your body, including the ones responsible for erections and sexual performance, there is a thin, delicate lining called the endothelium. Think of it like the inner wall of a garden hose. When that inner lining is smooth, clean, and elastic, blood flows through it freely, powerfully, in full volume. But when that lining becomes damaged through inflammation, oxidative stress, high blood sugar, smoking, alcohol, poor diet, or even chronic stress, that inner wall starts to stiffen. It starts to accumulate plaque. It starts to narrow, and blood flow gets restricted. Now here's why this is so critical for men specifically. The penis contains some of the smallest blood vessels in the entire body. The arteries that feed an erection, the cavernous arteries, are about 1 to 2 millimeters in diameter. That is tiny. So when there's even a small degree of vascular damage or restriction, the effect on erectile function is immediate and significant. In fact, many cardiologists now refer to erectile dysfunction as the canary in the coal mine for cardiovascular disease. If a man is experiencing ED in his 40s or 50s, there is a very high likelihood that his coronary arteries, the ones feeding his heart, are also beginning to show signs of compromise. This is not meant to scare you. This is meant to wake you up, because the same lifestyle changes, the same dietary interventions, the same natural compounds that improve blood flow to the penis are the same ones that protect your heart, your brain, and your longevity. So when we talk about blood flow for men's sexual health, we are talking about something that is life-saving, not just pleasure-enhancing. Now, what causes endothelial damage? Let me give you the big ones. Number 1, chronic inflammation. This is the silent destroyer. When your body is in a constant state of low-grade inflammation from processed foods, sugar, alcohol, stress hormones, your blood vessel lining takes a beating every single day. Number 2, oxidative stress. Free radicals, unstable molecules that damage your cells, attack the endothelium constantly. Unless you are actively consuming antioxidants to counteract them, the damage accumulates over years. Number 3, insulin resistance and high blood sugar. Glucose, when chronically elevated, acts like sandpaper on your blood vessel walls. It's one of the most destructive forces on vascular health that exists. Number 4, low nitric oxide production. Nitric oxide, NO, is the molecule that tells your blood vessels to relax and dilate. Without enough of it, vessels stay constricted, blood pressure stays elevated, and erections become inconsistent or weak. Now here's where olive oil comes in and where it falls short. Olive oil, liquid gold as the Italians call it, and I genuinely love it. I use it, I recommend it. Extra virgin olive oil is one of the most well-studied, most beneficial dietary fats on the planet. Let's be clear about that. The primary active compound in quality extra virgin olive oil is something called oleocanthal, a natural anti-inflammatory that works in a very similar way to ibuprofen, but without the side effects. It also contains oleic acid, a monounsaturated fat that improves HDL, your good cholesterol, and reduces LDL oxidation. Studies have shown that men who consume olive oil regularly as part of a Mediterranean diet have lower rates of cardiovascular disease, lower rates of erectile dysfunction, and better endothelial function overall. A landmark study published in the Journal of Sexual Medicine found that men on a Mediterranean diet, which is heavily centered on olive oil, had significantly better erectile function scores compared to men on standard Western diets. So yes, olive oil is powerful. But here's the catch, and this is the part that most content creators skip over. Olive oil alone does not adequately address all 4 of the vascular dysfunction mechanisms I just described. It reduces inflammation, yes. It supports cholesterol balance, yes. But it does very little to directly boost nitric oxide production. It does very little to combat the blood-thickening effects of insulin resistance. And it does not address the pH imbalance and gut vascular access issues that many men are silently dealing with. This is why I say never use olive oil alone. Not because olive oil isn't effective, but because you are leaving enormous potential on the table when you rely on a single ingredient for a complex, multifactorial issue. The solution, and this is where today's conversation gets exciting, is combining olive oil with something that fills in every gap that olive oil leaves open. And that something is apple cider vinegar. Apple cider vinegar, ACV. I know what some of you are thinking. Dr. Romano, my grandmother used to drink that stuff. And you know what? Your grandmother was onto something that modern science is now confirming with clinical research. Let me break down exactly why apple cider vinegar is one of the most powerful natural vascular tools available to men. Mechanism 1. Acetic acid and blood sugar regulation. The primary active compound in apple cider vinegar is acetic acid, and acetic acid has a remarkable effect on blood glucose metabolism. Multiple clinical studies, including a widely cited one published in the journal Diabetes Care, have shown that consuming apple cider vinegar before or with meals significantly reduces the post-meal blood sugar spike. In one study, insulin sensitivity improved by up to 34% in insulin-resistant subjects after consuming vinegar with a high-carbohydrate meal. Why does this matter for blood flow? Because, as I explained earlier, chronically elevated blood sugar is like sandpaper on your endothelium. Every time your blood sugar spikes and crashes, you are causing microdamage to your blood vessel walls. A CV essentially acts as a brake pedal on that glycemic response, protecting your vessels every single meal. Mechanism 2. Blood pressure and renin inhibition. Apple cider vinegar has also been shown to have a mild but meaningful antihypertensive effect. Research conducted in Japan, they are far ahead of the West in studying vinegar therapeutics, demonstrated that daily acetic acid consumption reduced systolic blood pressure in hypertensive rats, and follow-up human trials suggested similar benefits. The mechanism appears to involve the inhibition of renin, an enzyme in the kidney that plays a key role in elevating blood pressure. Lower blood pressure means less vascular resistance. Less vascular resistance means better blood flow to every organ in the body, including the ones that matter most to you as a man. Mechanism 3. Nitric oxide enhancement. This is the big one, and I want you to really pay attention here. Apple cider vinegar contains polyphenols, natural plant compounds with powerful antioxidant activity. These polyphenols, particularly chlorogenic acid, have been shown to stimulate the enzyme endothelial nitric oxide synthase, or eNOS. This is the enzyme your blood vessel walls use to produce nitric oxide. When you stimulate eNOS, you produce more nitric oxide. When you produce more nitric oxide, your blood vessels relax and dilate. When your blood vessels dilate, blood rushes in. More volume, more pressure, more flow. For a man, that means stronger, firmer erections, greater stamina, improved sensitivity, and and better overall cardiovascular performance. This is the mechanism that pharmaceutical drugs like Viagra and Cialis artificially manipulate. They are PDE5 inhibitors. They prevent nitric oxide from breaking down. Apple cider vinegar combined with olive oil takes a natural upstream approach, actually helping your body produce more nitric oxide in the first place. Mechanism 4, gut health and the vascular connection. This is perhaps the most overlooked piece of the puzzle, and it's one I'm passionate about because the research here is exploding. Your gut microbiome, the trillions of bacteria living in your digestive tract, has a direct, bidirectional relationship with your cardiovascular health. The bacteria in your gut produce metabolites that regulate inflammation, endothelial function, and even nitric oxide synthesis. When your gut is in dysbiosis, meaning the balance of good and bad bacteria is off, systemic inflammation rises and vascular health deteriorates. Apple cider vinegar, particularly raw, unfiltered ACV with the mother, that cloudy, stringy stuff at the bottom of the bottle, contains prebiotics and acetic acid that support a healthier gut microbiome. It lowers the gut's pH in a way that favors the growth of beneficial bacteria and suppresses harmful ones. Better gut health, lower systemic inflammation, better endothelial function, more nitric oxide, more blood flow. You see how this all connects? All right, now let's talk about why combining these two ingredients is exponentially more powerful than using either one alone. Think of olive oil and apple cider vinegar as partners. Each one has specific strengths, and together, they cover the entire spectrum of vascular health needs. Olive oil brings powerful anti-inflammatory oleocanthal, monounsaturated fats that protect the arterial walls. Vitamin E, a fat-soluble antioxidant that directly protects the endothelium from oxidative damage. Polyphenols like hydroxytyrosol that are among the most potent antioxidants found in any food. Apple cider vinegar brings blood sugar regulation and insulin sensitization, nitric oxide stimulation via polyphenol, ENOS activation, blood pressure modulation through renin inhibition, gut microbiome support and anti-inflammatory metabolites, acidity that actually enhances the bioavailability of olive oil's polyphenols. That last point is crucial. When you combine an acidic medium, like vinegar, with olive oil's fat-soluble compounds, the absorption of those polyphenols in your digestive tract dramatically increases. The vinegar essentially acts as a carrier and enhancer for olive oil's active compounds. This is why the classic Mediterranean salad dressing, olive oil and vinegar, isn't just a culinary tradition. It is, quite literally, one of the most vascularly protective food combinations in human history. Mediterranean populations have been eating this way for thousands of years, and the research consistently shows they have lower rates of heart disease, erectile dysfunction, and age-related vascular decline. But we can take this even further, because there are additional ingredients, things you very likely already have in your kitchen, that, when added to this base combination, create a protocol that is genuinely remarkable for men's blood flow and sexual health. Let me walk you through the full protocol. And before I do, if you're finding this valuable, this is a great moment to hit that like button. It tells YouTube that this content is worth sharing, and it helps me reach more men who genuinely need this information. Go ahead, I'll wait. Okay, let's get into the protocol. I want you to think of this as your vascular vitality protocol. These are the components, the science behind each one, and exactly how to use them. Component 1, the morning ACV tonic. Every morning, on an empty stomach or before your first meal, I want you to mix 2 tablespoons of raw, unfiltered apple cider vinegar. Look for the kind with the mother, 1 tablespoon of extra virgin olive oil, cold-pressed, high quality, the juice of half a lemon, for additional vitamin C and its own enos-stimulating flavonoids. A small pinch of cayenne pepper. Capsaicin is a potent vasodilator that directly relaxes arterial smooth muscle. 8 to 10 ounces of warm water. Mix it well. Drink it slowly over 5 to 10 minutes. Why warm water? Because warm water itself promotes vasodilation. It opens the blood vessels as the liquid enters your system, creating an optimal environment for the active compounds to absorb. This tonic, taken daily, addresses inflammation, nitric oxide production, blood sugar regulation, and gut health simultaneously, before you've even had breakfast. A word of caution, always dilute your ACV. Never drink apple cider vinegar undiluted. The acidity can damage tooth enamel and irritate the esophagus. Diluted and taken through a straw ideally, or rinse your mouth with water afterward. Component Component 2, the midday olive oil drizzle. This one is simple. At lunch, or your largest meal of the day, I want you to add a generous 2-tablespoon drizzle of extra virgin olive oil directly to your food. Not cooking oil, not olive oil that's been heated above its smoke point. Cold drizzled, because heat destroys the polyphenols and oleocanthal that make olive oil medically valuable. Add it to salads, to cooked vegetables, to grilled proteins. Let it sit on the food before you eat. The olive oil at midday ensures a sustained delivery of anti-inflammatory and endothelium protective compounds throughout the most active metabolic window of your day. Component 3, the nitric oxide boosting foods. Now, the tonic and the olive oil are your foundation, but I want to amplify your nitric oxide production with diet, because the more substrates you give your body for NO synthesis, the more it produces. The foods I want you to prioritize: beets and beet greens. Beets are the single most concentrated dietary source of nitrates your body converts directly into nitric oxide. A daily small glass of beet juice, or eating roasted beets 3 to 4 times a week, can have measurable effects on vascular function within 2 weeks. Dark leafy greens. Arugula, spinach, and kale are all high in dietary nitrates. Make them a daily staple. Pomegranate. Pomegranate juice contains punicalagins, which are among the most potent antioxidants studied. Research has shown pomegranate supplementation improves blood flow to erectile tissue specifically. One study showed a 17% improvement in erectile function scores after 4 weeks of daily pomegranate juice. Walnuts. Rich in L-arginine, the amino acid precursor to nitric oxide. A small handful daily provides meaningful vascular benefit. Dark chocolate. 70% cacao or higher. Flavonols in dark chocolate activate enos. Men who consumed dark chocolate daily in clinical trials showed measurable improvements in endothelial function. This is not an invitation to eat an entire bar. 2 to 3 squares deliberately, daily. Garlic. Allicin in garlic is a powerful vasodilator and antimicrobial. It directly inhibits platelet aggregation, meaning it keeps blood from thickening and clumping, which improves flow velocity through smaller vessels. Component 4, the evening wind-down protocol. This one is often ignored, but it's critical. Because cortisol, the stress hormone, is one of the most powerful vasoconstrictors in the body. When your cortisol is chronically elevated at night, your blood vessels stay tight. Your body is in fight or flight. Blood is shunted to your muscles and away from your digestive system and genitalia. In the evening, I want you to 1. Take a 15-minute walk after dinner. Mild post-meal exercise significantly reduces blood glucose spikes, reduces evening cortisol, and stimulates nitric oxide release through the mechanical shear stress of blood moving through your vessels. 2. Consider a small second dose of the ACV tonic at bedtime, this time without the cayenne, as it can be stimulating. Just ACV, lemon, olive oil, warm water. This nighttime dose helps regulate fasting blood sugar overnight, which is a major area of endothelial damage that most men completely ignore. 3. Prioritize sleep. I know that sounds basic, but human growth hormone, which is released during deep sleep, is one of the most powerful endothelial repair compounds your body produces. You cannot outsupplement bad sleep. 7 to 9 hours, non-negotiable. Component 5, what to remove. This is just as important as what to add. Refined vegetable oils, corn oil, soybean oil, canola oil, sunflower oil, these are high in omega-6 fatty acids that drive systemic inflammation. They directly compete with and undo the anti-inflammatory work of olive oil. Remove them completely. Sugar and refined carbohydrates. I've already explained what these do to your endothelium. Every sugary drink, every white bread roll, every pastry is a direct attack on your blood vessel walls. Alcohol. Moderate alcohol has a mild vasodilatory effect, which is why some people confuse it with being good for circulation. But chronic alcohol consumption devastates nitric oxide production, disrupts the gut microbiome, and elevates cortisol. It is a net negative for vascular health in any meaningful quantity. Smoking. If you smoke, I am asking you, as your doctor and as someone who genuinely cares about your well-being, please address this. Nicotine is one of the most potent vasoconstrictors known to medicine. It directly damages the endothelium. It destroys nitric oxide. The good news? The endothelium is extraordinarily resilient. Studies show that within weeks to months of stopping smoking, vascular function begins to measurably improve. Now, I want to take a moment to speak to you personally, because I know that many of the men watching this video aren't just curious about blood flow. You're here because something has changed. Because what used to come easily no longer does. Because you've noticed a difference in your energy, your performance, your confidence. And maybe maybe you felt embarrassed or ashamed about it. Maybe you haven't told your partner. Maybe you've been carrying this alone. I want you to hear me on this. What you are experiencing is medical. It is physiological. It is not a reflection of your worth, your masculinity, or your love for your partner. Vascular health deteriorates quietly, gradually, and almost invisibly, until one day it doesn't. The fact that you are watching this video, doing this research, taking this seriously, that is strength. That is the behavior of a man who refuses to accept decline without a fight. And for the partners watching this, because I know you're here too, the best thing you can do is create a shame-free space around this topic. The research is unambiguous. Psychological stress and performance anxiety are vascular events. Anxiety releases adrenaline. Adrenaline constricts blood vessels. Constricted blood vessels make the physical challenge worse. It becomes a cycle. Breaking that cycle starts with communication, with understanding, with knowing that this is a health issue, one that is absolutely addressable with the right tools, the right lifestyle, and, if needed, the right medical support. You are not alone, and you are not stuck. I would be doing you a disservice if I didn't address this directly. Natural protocols, like the one I've described today, are powerful supportive tools. They are not replacements for medical evaluation when one is needed. If you are experiencing erectile dysfunction that is persistent, meaning it happens more than 50% of the time, please see a doctor. Not because you should be embarrassed, but because, as I mentioned earlier, erectile dysfunction can be an early indicator of coronary artery disease, diabetes, hypertension, or testosterone deficiency, all of which require proper diagnosis and management. If you are experiencing ED and you also have symptoms like chest pain, shortness of breath, unusual fatigue, or extreme thirst and frequent urination, please seek medical attention promptly. Natural interventions and medical treatment are not mutually exclusive. In my clinic, I use them together. The lifestyle protocol I've described today is one I give alongside whatever medical treatment is appropriate, because it enhances every intervention. You deserve comprehensive care. Please don't let shame delay you from getting it. Before I wrap up, I want to ask you to do something for me. If this video gave you something valuable, whether it's one new fact, one new habit, or just the reassurance that what you're going through is normal and fixable, please hit the like button right now. It genuinely helps this channel reach more men who need this information. And I want to hear from you in the comments. Tell me, are you going to try the morning ACV tonic? Have you already been using olive oil? What questions do you have? I read every single comment and I respond to as many as I can. If you are not subscribed yet, what are you waiting for? Hit that subscribe button and the bell notification, because every week I bring you content just like this, science-based, practical, and completely judgment-free. This is a safe space for every man and every couple who wants to thrive. All right, let's bring this home. Your blood vessels are living tissue. They breathe, they respond, they adapt, and, most importantly, they heal. The endothelium that lines your arteries, your veins, the vessels that feed your heart and your sexual organs, it is not fixed. It is not permanently damaged. Given the right environment, the right nutrition, the right lifestyle signals, it regenerates, it repairs, it performs. Olive oil alone is not enough. Apple cider vinegar alone is not enough. But together, with beets, with pomegranate, with garlic, with sleep, with movement, and with the courage to actually do the work, you have at your fingertips one of the most complete natural vascular protocols in existence. You don't have to accept decline as destiny. You don't have to reach for a prescription before you've tried the power of what nature and science, combined, can do. Start tomorrow morning. Mix that tonic. Take that walk. Eat those greens. Drizzle that olive oil. And then come back here and tell me how you feel in 30 days. Because I already know the answer. I'm Dr. Lila Romano. Thank you for trusting me with your health today. Take care of your body. It is the only one you will ever have. I'll see you in the next video.